Hey everybody, it's Lisa with Lisa Bug Fitness and Yoga. It's time for another joint replacement update, and it's been a while. In fact, 2 days ago, today is September 20th, 2025, 2 days ago was the 2-year anniversary of my left knee replacement. Wow, can you believe it's been 2 years already? And what a crazy 2 years it's been. But the left knee is actually doing quite well. I'm very pleased with the total outcome of the surgery. The severe valgus knee or knock knee that I had was definitely corrected. I have a very nice straight leg, and it's very functional for me to do really anything that I need to do in life. My range of motion is terrific and all of that. I do have a little bit of achiness and stiffness, a little bit of minor swelling from time to time depending on how much I do. And my strength is not 100% in my quad. But I saw Dr. Mayer in May, and he said, Lisa, you may never get back to 100% strength in your quad because of the number of surgeries you've had on that knee. And that does make sense. About 20 years ago, I had what's called a lateral release on that knee, where they actually cut some of the quad because it was pulling my knee off to the side laterally. So it does make sense that I may never get my strength totally back in that left knee. In terms of my hips, they're both over a year out. I had my right hip done July 1st of 2024, the left hip 6 weeks later, August 12th, 2024. And looking back, if I had to go back and do it again, I would not have done those two surgeries as close together as I did. I was on a little bit of a time crunch to get down to Florida, so that's the way I did it. But I believe that 3 joint replacements in less than 11 months was way too much for my body to handle. By the time I hit that 3rd joint replacement, my body didn't have a lot left for healing, and it really slowed things down. So, but I'm doing pretty well. My strength is getting back. I do have a significant amount of stiffness though if I sit. This is my biggest complaint. If I sit for even 10 minutes driving to work, I get out of the car and I can't just get out and walk away normally. I have to take a few minutes to stand up, to start walking. I feel like I'm walking like an old lady, and then finally my mobility will kick in, my gait will improve, and then I'm feeling fine. So I guess I just have to keep moving. Motion is lotion, as they say, right? But the pain that I feel and achiness in the hips is very random. It's never the same. It's never on the same hip. It's one or the other or both. It can be in the front of the hips, in the hip flexors. It can be outside the hips in the IT band area, deep inside the inner groin. So I don't really know what the issue is with that. And I have an appointment scheduled with Dr. Mayer in about 3 weeks. And I'm going to discuss this with him and see if there's anything that I can do to improve this, or if it's just something that takes time. But other than that, I'm doing well, with the exception of my right knee. Yep, I know, another knee. So my right knee is deteriorating pretty quickly. I'm starting to develop advanced stage arthritis in the lateral aspect of the knee, which means it's starting to become knock knee, a valgus knee again, as I did with my left knee. And my range of motion really isn't good at all. I can't get my leg fully straight. I can't bend my knee more than 90 degrees without a significant amount of pain. So I know that another joint replacement is in my future. It's just, how long can I put this off? How long should I put this off? So I'm in this appointment with Dr. Mayer, I'm going to talk to him about something called plasma-rich platelet, no, it's the other way around, platelet-rich plasma injections, and see if that's something that he recommends or that he even does. And I did try a series of 3 Euflexa injections. This is that hyaluronic acid material that goes into the joint. Did it help? I'm not sure, maybe a little bit. I know I can also do a cortisone injection, but sometimes there are side effects with cortisone. It can actually deteriorate your cartilage quicker, so I'm not sure I want to go there at the moment. But I want to talk to him about some other options that might put off the joint replacement surgery for a while. But I've been teaching my classes, doing really well with that. In fact, I did a 12-week step aerobics series on the virtual Y, and I wasn't too sure I could handle it, but I started out slowly. It was for beginners, so I taught it with slow music, with easy steps, and then over the 12 weeks, I started ramping up the difficulty, started increasing the pace of the music, doing more complex step movements, starting to put things together, and it turned out great. It was great not only for my own physical recovery, but for my mental and emotional recovery as well, because it's been a pretty tough road the past 2 years. So that went wonderfully. But we're getting ready to head back to Florida here in about a month. And I'm going to be excited to spend some time down there. So I just want to get my knee feeling like I can be pain-free for the winter, and then we'll see what happens once I come back to Minneapolis. And maybe about this time next year, late September, will be another joint replacement for me on that right knee. But I'll keep you all posted. Thanks for tuning in and following, and I'll talk to you next time, everyone. Take care.